Okay, this is a case with a student. We're asking the question, do I need to go to the RCP or not? Okay. The patient here has anterior teeth, upper, and only unilateral lower teeth. Okay. That means the patient wants to bite on them for chewing food. Usually those that have unilateral occlusal stops only, not bilateral, will tend to have habitual biting patterns. They create those patterns to meet the lower with the upper while chewing the teeth. This is why they have these habitual patterns. These patterns are usually eccentric or off the centric relation. It could be protrusive, most probably. Okay, and another thing, it might be towards the lateral because this is the occlusal stop. She only has a unilateral occlusal stop. Here, sorry, she would have these stops, these teeth with these teeth. So it also might have a shift component in it. So my question is, do I need to go to my RCP in these cases or not? Second question is, do I accept this vertical dimension or not? Okay. Usually we go and record what we have inside the patient's mouth. So I'm going to go to the patient's mouth and see her bite clinically. Okay, this is the bite intraorally. بدي أقول لك ارفع لسانك لجوا آخر على آخر طحونة وابلع ريقك وقضي. I'm going trying to let her. Okay, you can see the habitual bite. She's always shifting from the maximum opening arc. She is going laterally to meet the upper with the lower teeth. Okay, so there is some component of deviation. Okay, there is also no component of vertical dimension loss. تعدي لي من 1 ل 10. عدي انت لحالك.
1 2 3 4 5.
The freeway space is not lost. She has sufficient freeway space, so no loss of vertical dimension. Okay, so she has the vertical dimension, but she has the shifted biting position. Now, if I'm going to do my try-in on what I have now, I will have a shifted bite. Okay, do I accept it or not? The question is, does she have symptoms or not? Some patients adapt to these shifted positions. I'm going to check. I'm going to let you do a full mapping of masticatory muscles. Okay, you're going to palpate the temporalis, you're going to palpate the TMJ, and you're going to palpate the masseter. Intraoral and extraoral, you're going to palpate it by digital. I'm also going to let you also do the other side, and then after that, I'm going to let you hear if there is a click. You're going to put your finger inside the ear, and this is the function of palpating the TMJ from inside the ear. You begin to hear the crepitus. You don't hear it actually, you feel it. Sometimes the click is not audible. You don't hear it, but you can feel it with your fingers. So the best way to feel it, if you put your fingers through the external auditory meatus towards the TMJ, you begin feeling the movements from inside the TMJ. So I want you to do these 3 tests. Is there a crepitus? Is there clicking? Is there the deviation? Is there? I already seen it. Is there any muscle tenderness? If the patient doesn't have any TMD, including any of these symptoms, I could reproduce the bite here. If she has any signs of TMD, I have to relieve it by actually going back to the RCP. Okay, so this is a good example of the cases where we have both choices to do. Some would recommend go immediately to the RCP, so you would make the patient get used to the new position and be ready for extractions, which will happen very soon because these are a minimum number of teeth. And although they are stable now, but we might recommend that they're going out. Some people would recommend that go to the RCP immediately. But if you use the bite present, there is no need for increasing the vertical dimension or making any shift in the freeway space. So I'll keep the vertical dimension as it is, and I might accept it if there is no TMD symptoms. Okay, just for a short period. Remember, this is a interim prosthesis. Thank you.